Hey, welcome back to the Alpha Mega Biz Dev podcast. This is the podcast for small business owners, especially chiropractic business owners. If you want to take your business to your eventual dream practice, this is a place where I give free strategies and business tips. On today's topic, we're going to talk about what new graduates should do. So, best advice for new chiropractic grads. And this comes from a very recent interaction I had with a chiropractic school student who has about 1 year left in their schooling out in Texas. And this young gentleman came to shadow my clinic, I believe it was just last week, very recently. And really bright young man, very motivated, driven. I could tell he's going to be successful in his chiropractic future, just the way he conducted himself, the way he even requested to come out and shadow our clinic, just his professionalism, very courteous. He even was very friendly and could make small talk with our patients while he was shadowing our clinic that day. But he asked me, we sat down after a full morning of seeing patients. Then we sat down for about 20 minutes and I allowed him to just have an open discussion with me to ask him whatever he wanted. And so this young doctor, young student, actually asked me what would be the best advice that I could give someone like him, someone who is going to graduate soon and go out in the real world to become a chiropractor. And so he was actually asking if he should buy a clinic. He mentioned that there were some clinics in Southern California that were up for sale, so he was considering buying one of those, and is that the right thing to do? So what I advised him was that is not the best thing to do. It takes a really special person, and he might be that special person, but it takes a real special person. Very few people can actually just get right into their clinic just from the get-go and succeed without any struggles. Most chiropractors do have to go through certain steps to eventually have their own practice. So when I gave him this explanation, I think it kind of maybe deflated him a little bit because he was really hoping he could just get right into having his own practice right out of school. But I explained to him the percentages and the odds are against him. So I went about explaining step by step what I'd recommend that he and the vast, high majority of chiropractic new graduates should do in entering the real world. Okay, and let me preface this by first explaining why did I burst his bubble, right? Because it wasn't to shoot him down. It wasn't to disappoint him, okay, or to shatter his dreams. But it's because, as a chiropractor who's been in practice 22 years myself in a very competitive Southern California, where there's tons of chiropractors, where you really have to understand the landscape of the market, and you have to understand marketing. You have to understand what the people want in your community. I've seen it. I've seen tons of doctors fail and fall out of practice. And I've seen the ones that really succeed. I've seen why they succeed. Okay. And I've seen the journey that a lot of chiropractors have gone through to get to their own practice. So I was giving this young man advice based on real experience and just being really in tune with my chiropractic industry for so many years, for over 2 decades. So the other thing, for those of you who are listening who are not in the chiropractic world, chiropractors, when we get out of school, it's rough. Chiropractors, it's an uphill climb to really succeed, because in our society, even now, even at the time of this recording, late year 2024, we have to understand that general society understands that certain types of healthcare professionals or doctors that you can seek help for are part of the routine or standard of care that they need for their health. For example, most people would say, yes, I need a primary care physician or medical doctor to guide me along my health journey, to run tests for me, to tell me about blood pressure, in case I get really sick, to screen for certain things, right? Also, people generally say that everyone needs a dentist. That, hey, I've got teeth, so I need a dentist from time I have teeth as a young child until death, right? Our whole life we need a dentist. So most people would say, okay, my whole life I need a doctor and a dentist to help me. Okay. And then there's obviously other specialists people need, like some people need optometrists, ophthalmologists, cardiologists, what have you. But in today's day and age, it's still a minority of people that actually consider chiropractic care as a standard necessity and routine of care that you should do to just overall stay healthy. Because a lot of people look at chiropractors as just a pain relief doctor for when you have neck pain and back pain or spine-related problems. And yes, we are great at that. We're specialists at resolving those issues. But there's also an overall nervous system connection. And if you're a chiropractor and you are, really sound in your philosophy of chiropractic, it's like preaching to the choir. You understand this, you believe this, you live this every day seeing patients. We help people to have even just overall healthier lives by keeping their nervous system in tip-top shape, by keeping their spine free of interference on their nerves and spinal cord. And so I've seen patients throughout my career where their acid reflux goes away, their constipation goes away, IBS, irritable bowel syndrome, fertility issues go away, incontinence, asthma, sinus issues, allergies, congestion, vertigo, dizziness, tons of things that most people think, okay, I got to go see a medical doctor or an MD specialist to resolve those issues. I've helped case after case of those things. And I know, again, you chiropractors listening and we're watching, you've experienced that too, right? If you really practice and go about treating and helping people being subluxation free, we call these subluxations. If you can correct subluxations, then the body just works more optimally. Right. So I know us chiropractors who live this every day, we know how vital and necessary that lifelong chiropractic care is. So, we believe that you should really have your spine cared for and looked at and adjusted and addressed and helped and strengthened from childhood, right? Because we're all born with spines, right? And through your whole life, through teenagers, young adult, mid-adult, later years in life. Your spine needs constant attention. So the point I'm trying to make is when chiropractors come out of school, we think that, hey, the whole world needs us. But the big kind of slap in the face that we get is like, oh my gosh, the whole world doesn't know that they need me. It's a rude awakening. And I remember that when I first came out of school, I realized, wow, we have to really work on educating our patients. And we have to have systems in place of telling them about what chiropractic is and how it works and how it helps their spine, yes, their pain, but also helps their overall nervous system and their overall health to function more optimally. And there's a constant education and almost convincing of people that, hey, you shouldn't just come for the few months that it'll take to get you out of pain, but you really should come check in with us every so often for the rest of your life, right? Like you see your medical doctor, like you see your dentist. And so there's gonna require some time before our society really gets up to speed with that. But I needed to really just kind of lay down this preface of, hey, why am I even bringing this topic up? And, why am I even stressing that, hey, young chiropractors coming out of school, that there's a certain path that you have to take and it's not going to be as easy as you think, because that's the reality of our society. Most people in our community trust medical doctors, typically very, kind of wholeheartedly and almost sometimes just kind of blindly trusting that the MD's word is above all. And I'm not saying that I'm against medical doctors. Medical doctors are great. We need them, right? But I think there needs to be a far better understanding that your spine needs attention and care through chiropractic, through physical therapy, a spine specialist if you need it. Okay, but there is a bigger role that chiropractic, honestly, I think needs to fill in our society, and that's just a matter of time. Eventually, I think the society that we live in will be educated to know that, okay, lifelong spinal care and chiropractic help is very, very essential for my whole life and for my whole family. Okay, so so the reality is that when we come out of school, it's like a big slap that, okay, it's not going to be as easy as just patients flooding to us, that we really have to work at it, right? From the business aspect, from a marketing aspect. And so what I usually see is that most grads, new chiropractic grads, in that first year and second year, this rude awakening happens for almost all chiropractors, unless they're like that blessed 1% that they're just gifted. Maybe they come from a family chiropractor, so they understand how the business works. They have a leg up or two on the business side of things, marketing side of things, so they have success right away. But that's very, very tiny percentage. So most chiropractors, when they graduate, they come out, they have this rude awakening, like, wow, I really have to work at this. I really have to work at getting new patients in the doors to even trust that I can be of service to them. So I have, 3 main steps, right? So let me get to the meat of this podcast episode, which is, what is the best advice I would give a new grad coming out of school? And it's really 3 main steps with maybe a couple sub-steps in there that I strongly advise you. Hey, if you're the chiropractor right now, or you're the student, or you're about to graduate and you're listening to this or watching this, here is what I recommend. You graduate at a school, okay? Do not set your eyes on opening your own practice from scratch or buying a practice. Just do not do that. You need a lot more experience. Work on being an associate doctor first, okay? Because chiropractic college is a 4-year program, but what we don't have in the end is an additional 2-year residency like medical doctors do. Medical doctors have a 4-year education, but then they have a plus 2-year time of residency where they're working, getting paid, but they're in a hospital setting or clinic setting and really understanding for 2 years how to be a doctor in the real world, how insurance works, how payments work, how clinical things work. And as chiropractors, we don't have that. There are no residency programs. So for us, it's the closest thing to that is called an associateship, or being an associate doctor. And this is where you work for another chiropractor, typically a veteran chiropractor, and they need the additional help. So you go work for this doctor, you get paid. Sometimes it's little, sometimes it's moderate, sometimes it's paid well, and you're learning typically and I recommend a 2-year associateship, okay? And these are steps that I actually went through myself, okay? So I'm not saying to do anything that I didn't go through myself. I was an associate for 2 years and worked for a really good doctor in the Bay Area of California. He came from a family of chiropractors, so really strong chiropractic philosophy. When I was in his office, my senior doctor, his adjusting skills were elite level, so I really learned a lot about adjusting. He was a great businessman. He understood marketing. He sent me out to a lot of marketing things, and I learned a lot, right? And I think I got lucky because it was actually a fellow classmate who was working there towards the end of their schooling, just I think just to do some part-time work to get experience to make a little money. But they made the introduction. They were moving away to Texas, and I was choosing to remain in the Bay Area. I went to Palmer West, San Jose, and they made the introduction, and it was actually just my first opportunity. And I interviewed, I got it, and boom, I started working. And while I was there, I was young. I was 25 years old when I graduated chiropractic college. I didn't appreciate it. So I was actually very immature, not in the mindset of, being humble and really embracing the opportunity that was there. I did my work, but I remember complaining, maybe not to my employer, but, to others, that I wasn't getting paid a lot, which I wasn't. But in retrospect, the value I got it didn't matter what I was getting paid. And I got sent out to marketing events quite a bit. They're called spinal screens, where we get sent out to, either, gyms or special events or businesses or street fairs, and it's face-to-face marketing. And I got sent to a lot of those, even farmers market, and I hated it. I thought this was horrible. This is not what I signed up for. I didn't go to school to be a chiropractic doctor to do this kind of stuff and to really do sales and marketing face-to-face out on the street. Like this is the worst, right? But little did I know that with every tough outing, every patient interaction, I was learning. I was acquiring skills. I was learning how to just talk to people about chiropractic, to listen to them, to respond to them, to get the timing right, and that this would be a valuable skill that I would carry over through my career, that it was a skill that I would never lose, and a skill that I now teach chiropractors with my consulting program how to do for themselves, that I was learning a lifelong skill of how to acquire patients. Just a good old-fashioned traditional way of face-to-face marketing. So, my first boss, I won't say names, but if you're listening to this by chance, Doc, thank you for making me do all those screenings. I learned a ton, and it helped me in my career to never be worried that I didn't know how to get new patients. If the internet went away today, it's okay. I can go to gyms and events, and I can talk to people and get new patients into my clinic, because it's a skill that I will never forget. And I've actually mastered that skill, and that's what I teach to chiropractors. So things like that I learned, again, adjusting skills I learned, just observing my senior doc, how he went about carrying himself with patients, communications with new patients, existing patients, how he led team meetings, just how he led the whole practice of business. I soaked it all up. And when I left there after 2 years, I didn't really appreciate it. But later I did. I really understood that those first 2 years were pivotal. So first step is find a good associate position, and be careful on where you apply to and where you take this position, because that first 2 years will have a huge impact on how you go about practicing chiropractic yourself. So make sure it's not for, if you don't see yourself maybe working in a personal injury clinic with all PI patients, don't do that. Right? If you don't want to do pediatrics, don't work at a pediatric clinic. Okay. If it's an all geriatric clinic, don't work. Work where you can envision that demographic or that style of chiropractic, that you will perform that for the rest of your career. Okay. And then once you're done with that training, you've worked a lot, you worked hard for this senior doc, and you feel like you can duplicate some of the success on your own. Then step 2. Or second bit of advice is to go seek out a place where you could become an independent contractor or an IC. This is where you just simply rent space, either one treatment room or get to use the whole clinic facility. And there's usually a percentage split on your gross collections. But the downside is you have to fend for yourself as far as getting new patients. They typically don't hand patients to you. But the trade-off is that you have freedom to go about clinical things the way you want to do it, your schedule, how you want to do it. You get to utilize their staff to help you with, again, scheduling and assisting patients in and out, checking in and out. But an independent contract position is a second step. Okay. Now, what I recommend at this level is kind of a sub-step or another recommendation, which is get yourself a good coach or consultant. And this was key for me. I didn't get a first coach until my third year of being an independent contractor. It was after struggling for about 2.5 years as an IC, not really making it, not knowing why I couldn't duplicate the success that my senior doc taught me during my associateship. That's when I got my first coach and really turned things around. So finding the right coach or consultant is really important. One that kind of fits you well, has business principles and philosophies that you resonate with, that you want to learn for your practice. Okay. Now, in this step of becoming an independent contractor, this is where you're building your own patient base, because the goal is to build up enough patients that now when you have enough patients that you're seeing is consistent, you have a monthly recurring revenue that's pretty consistent and there's a good average there. At a certain level and threshold, that's when you can get your own clinic and your own actual office to have for the first time. And for me, it was 3 years. Okay, so again, 2 years of associateship for myself, then 3 years of being an IC. Then at the end of that 3 years, I had enough new patients to really feel like I could take this base of patients to my own clinic, which was then a mile down the street. I picked a location to do that. And going back to the value of having the right coach. My first coach, who was also a coach of my senior doctor, my senior doctor had several coaches, but he said that the coach that he recommended for me was one of his best ones. I got that coach 2.5 years into my IC term and immediately turned things around for me. So, as soon as you can afford it, the earlier you can get the right mentorship, the better, the faster progress you're going to have. Okay. Another important step during your independent contractor term is visit successful chiropractors. Okay, visit as many chiropractors as you can so you can shadow them and learn and absorb and see how they do things. Take notes, apply those things that you learn and see into your own practice that you're building as an IC. And the IC position is low risk, right? So if it doesn't work out, then you're not the one that has a lease agreement. You're not the one that's on the hook for paying the staff. It's a much better way to go right after an associateship. Okay, so don't jump from associateship to having your own office. You still have a lot to learn, a lot of grooming that has to happen, a lot of maturity that has to happen professionally, personally, during your time as an independent contractor. Okay. Then once you have enough patient visits, enough income coming in, and it's reproducible and is predictable, and also your ability to get new patients, it's predictable and effective, and no matter what, you can do marketing that gets new patients in. And for me at that time, spinal screenings was one of those. And again, I learned that from my associate doc position. I went to the gyms literally 2 to 3 times a week to a 24-hour fitness gym to get the bulk of my new patients. I was also at that time running my own Google AdWords. It's when Google AdWords was in its infancy and it was super easy to run them. Didn't take a whole lot. It was really easy just to make a few clicks and run your own ads. So between that and spinal screening 3 times a week at the local gym, I knew how to get new patients. Okay. Then step 3, new grads. Now you have your patients. You kind of have an understanding of how business goes in chiropractic. Now you're ready to kind of search the area that you're in, your community. You don't want to go too far, maybe a mile or less. And now you're going to basically take those patients that you built. And obviously there has to be clear agreement with the place that you're doing this IC term with, that, this is your plan and you're able to take patients out of that clinic. Now you go get your own clinic, right? You open your own practice, and then you can, design it hopefully however you want. Also, this will be the time if you want to purchase a clinic, this is the time. So if there's a great clinic, has all the equipment, and the purchase price seems fair and you can qualify for a loan for that, this is the time, okay? But also it's a great time just to find a location, have it built out with a TI allowance, a tenant improvement allowance from the landlord, build it however you want. And this is, again, where a good consultant coach can help you with layout and design and understanding every step of the way of building your own office. And now, hopefully, you are in an office that's going to serve you for years to come, that's going to serve your community for years to come, that's going to build your life, that's going to really financially fuel the life that you're, dreaming to live. And for myself, that was 2008 when I opened my clinics in Irvine, and I've been there ever since. So that's what a good 17 years about, right? That I've been in that same location, and it's been a great location where we've had a lot of prosperity. We've thrived, we've flourished. We're still thriving and flourishing. We're still growing after all these years. But new grads, if you're lost, or you had your mindset on, as soon as I graduate, I'm going to go open my own clinic and this is what I'm going to do, I don't need any advice, I would just say, hey, have some humility. Just learn from a person who's been through all of that. Listen to someone who's seen a lot of different chiropractors go through those exact same stages. Okay. Also, I've interviewed a lot of doctors who have applied to be an associate in my clinic over the years. Majority went through that initial 2-year or even longer, 2 to 5 year kind of shock. Like, oh my gosh, making it in the chiropractic world is hard. It is really not easy. It's actually super hard. That if you go through these steps, step 1, 2, 3, associateship to independent contractor position to venture your own office, this is going to be your safe route, right? It's not a sprint. but it's slow and steady, to be honest. So think of the first 2 years out of school, you're going to really learn a lot more from a veteran. Then you're going to be on your own, but with less risk in someone else's office. Grow your patient base, grow your practice, learn how to become a better chiropractor, learn how to become a marketer in chiropractic, learn some business skills. Then step 3, then you can open up your office that you've been dreaming of, that you've worked so hard to build. And that can, honestly, that one location, it could serve you for your whole career and become your dream practice. And if you obviously live in a region of the U.S. or world where buying your own building and all that is a great step, then obviously that would be another step eventually. But these 3 steps are the best advice I can give new grads coming out of chiropractic school that should lead you to success. Okay, so I hope that is valuable for those new grads listening. And hey, if you're a veteran chiropractor, if you've been in the game for a while, and you happen to get a young doc that comes and gives you or asks for opportunity to shadow and wants advice, I would say, hey, feel free to share this advice, these 3 steps that I'm sharing on this episode. All right, so that's all I have for you guys today. But this was inspired by, again, a recent student that's about to graduate in a year, wanting to know my best advice on what I'd recommend for him or new grads, and this is it. Okay, these 3 simple steps. Yes, it's work. Yes, it's not an instant thing, but anything worth having in life, you got to work for. And the ultimate prize at the end is so worth it to eventually have your dream practice that fulfills your life and financially fuels what you need in life and also serves your community. Okay, folks, so Dr. Lee here with Alpha Mega Consulting. And obviously, if you're a new grad or you're at a position and you do need a coach, you need more advice and you need more guidance, we obviously have services for that. We've got a coaching program. We've got online course. So just reach out, alphamegaconsulting.com, and we'd be happy to point you in the right direction. All right, tune in next time, and we'll be back soon from the Alpha Mega Biz Dev Podcast. See you soon.